More than 5 years after the COVID-19 pandemic made the world tremble, humanity again faced a global health threat, a mysterious disease in the Republic of Congo. In the remote land of Congo, south of Congo, this disease is spreading fear when in just 2 weeks, hundreds of people have fallen, with the death rate of 7.6%, many times equal to 1% of COVID-19. The big question is this X disease, the language that WHO has set for a future pandemic, as dangerous as COVID-19 or more? According to a report from WHO, the outbreak of the epidemic in late October 2024 to the end of December recorded more than 400 infections and 31 deaths. What is worrying is that this disease not only causes serious damage to people, but also targets the most vulnerable groups, children under 5 years old. Most of the cases are from the malnutrition group, showing a very volatile link between economic conditions, poor social conditions and the ability to fight the epidemic. In the Panchi region, the mental state of the epidemic, the poor living conditions are increasing challenges. Here, 700 kilometers from the capital Kinshasa, the health system almost does not exist. Medicines and equipment are seriously lacking. WHO epidemiologists have to spend 2 days to cross the road to reach the area. They are working hard to collect samples of patients and find the cause of the disease, while the local government calls on people to limit contact with patients or deaths to prevent spread. The weather conditions are harsh with heavy rains, long-term malnutrition, low vaccination rates, and the climate conflict have made this place an ideal place for any outbreak. Dr. Masezidou Muati, who's regional director, said, "We are trying to understand this disease better, from the path to the most effective control measures." However, the challenge is not only in Panchi. The current epidemic is also threatening to expand to nearby areas and even cross the national border, with more than 47,000 people suspected of mpox. Mosquito bites and thousands of deaths each year from diseases such as SARS-CoV-2, and the Congo facing a battle. Meanwhile, in Asia and other regions, the COVID-19 vaccine is still of value. Countries such as Thailand, Japan, Hong Kong and China have immediately implemented strict quarantine measures. In Thailand, airports and border gates are tightly monitored. Passengers from areas with high risk of strict medical checkups. Japan has even issued travel restrictions on affected areas. Hong Kong not only checks the temperature at the airport, but also requires quarantine and detailed testing for any suspicious passengers. This mysterious epidemic has raised concerns about a new cause of disease that could be overcome from the Congo border and become a global threat. Congo Health Minister Samuel Rochkumba said, "We are at the highest alert level and continue to monitor the situation." However, with limited conditions, the efforts of Congo need strong support from the international community. Note that the epidemic occurs as Congo has just gone through serious outbreaks and serious injuries. Many experts say that if this disease is not controlled in time, it can spread to neighboring countries such as Angola, where the deal with Congo is still taking place. WHO assesses the risk of the epidemic spreading over a global range is low, but the situation in the region needs close monitoring. Local people, such as Mr. Claudio, who just lost his wife and 7-year-old daughter because of this disease, expressed confusion. "We don't know where it came from. The person who got the disease started to get high, got sick, and then died in just a few days." This is the story of hundreds of families in Panchi, a tragedy that seems to repeat itself in this country. The mysterious disease in Congo is not only a warning to this country, but also a lesson for the whole world about the need for a strong health system and international cooperation. Is this the disease that WHO has predicted? And is mankind fast enough to stop a pandemic before it's too late? Time will tell us the answer. But it is certain that countries cannot be mistaken. It's time for the whole world to act in unison. Because in a globalized world, no epidemic is a country's own problem.